1. Tell me about yourself and your ward experience. Why they ask, to summarize your clinical background, communication style, and fit with the ward.
Model answer. I am a registered nurse with X years of clinical experience, most recently in medical and surgical ward settings. I have cared for acute and chronic medical patients, managed post-op surgical care, and worked collaboratively with multidisciplinary teams. My strengths include strong assessment skills, prioritization, and building therapeutic patient relationships.
2. Why do you want to work in a medical/surgical ward in AUS/NZ facilities? Why? Interviewers want to see alignment with the role and an understanding of the practice environment in Australia/New Zealand.
Model answer. I am interested in this role because I enjoy the diversity of medical and surgical care, the fast-paced environment, and the opportunity to work with a wide range of conditions. I've researched your facility and appreciate your commitment to evidence-based practice and patient-centered care, which aligns with my professional values.
3. How do you prioritize care when multiple patients need attention? Why? Ward nurses must juggle competing clinical priorities.
Model answer. I prioritize based on acuity, safety issues, e.g., airway, breathing, circulation, and time-sensitive tasks. I use ABC and patient observation data, then delegate where appropriate, communicate with the team, and revise priorities as clinical conditions change.
4. Describe a time you handled a difficult patient or family member. Why? Assesses communication and de-escalation skills.
Model answer. In a previous role, a family was upset about a delayed medication. I listened actively, explained the clinical reasoning, apologized for the wait, and provided reassurance. I involved the senior RN to ensure their concerns were heard. The situation de-escalated, and the patient later expressed appreciation for how we handled it.
5. How do you manage your time on a busy shift? Why? Nursing management of workload is essential in ward settings.
Model answer. I start my shift by reviewing patient needs, setting priority tasks, and checking for any outstanding orders. I update care plans regularly, communicate with the team, and document clearly so handovers are efficient. I remain flexible when unexpected events occur and reallocate as needed.
6. What clinical skills do you use most in Med-SURG nursing? Why? Tests practical competency awareness.
Model answer. Key skills include accurate assessment, vital signs, pain, neuro checks, IV therapy and medication administration, wound care, discharge planning, and patient education. I also use risk assessments, falls, pressure ulcers, and ensure prompt escalation for changes in condition.
7. How would you handle a patient who refuses care or medication? Why? Scenario-based behavioral question.
Model answer. I would explore their reasons empathetically, provide clear explanations about benefits and risks, check for misunderstandings, and ensure informed refusal is documented. I would involve the interdisciplinary team if needed and respect the patient's autonomy while ensuring safety.
8. Tell us about a time you had to advocate for a patient. Why? Advocacy is central to nursing practice.
Model answer. A patient's pain was uncontrolled despite PRN orders. I discussed this with the patient, documented findings, and contacted the medical team to request a pain management review. Orders were adjusted, and the patient reported improved comfort.
9. Describe a clinical emergency you managed. Why? Evaluates response in high-pressure situations.
Model answer. When a patient's oxygen saturation dropped unexpectedly, I initiated oxygen, called for assistance, checked airway and breathing, and notified the registrar. I stayed with the patient, reassessed regularly, and documented changes until the situation stabilized.
10. How do you prevent and manage hospital-associated complications? Why? Quality and safety focus in AUS/NZ standards.
Model answer. I use risk assessment tools, falls, pressure injury, ensure early mobilization, strict infection control, and patient education. I monitor for early signs of complications and escalate promptly when there are concerning trends.
11. How do you collaborate with the healthcare team? Why? Teamwork is essential.
Model answer. I communicate clearly during handover, use structured tools like SBR, involve allied health when needed, and ensure shared decision-making in care plans. Collaboration ensures continuity and quality of patient care.
12. Where do you see your nursing career in 3 to 5 years? Why? Shows ambition and alignment with professional development.
Model answer. In the next few years, I aim to deepen my SURG skills, complete relevant certifications, and take on informal leadership roles like preceptor or clinical resource nurse, contributing to best practice care.
13. What are your strengths and weaknesses? Why? Self-reflection and honesty.
Model answer. Strengths. My strengths include prioritization, empathy, and evidence-based care. Model answer. Weakness. I'm working on balancing thoroughness with efficiency. I use checklists to maintain quality without slowing workflow.
14. Why should we hire you? Why? Final pitch.
Model answer. I bring solid clinical skills, a patient-centered approach, a commitment to quality care, and the ability to work collaboratively in busy SURG wards. I am adaptable, eager to learn, and committed to contributing to your team.
15. Questions you should ask interviewers. Important but often overlooked.
Examples you can put in your video as bonus content. What are the expectations for new staff nurses in the first 6 months? How does the ward support continuing education? What is the typical nurse-to-patient ratio? How does this unit measure and improve patient outcomes?